Hello, and welcome to Healthcare Insights. I'm your host, Hamid Mahmood. After being in the US healthcare industry for over 20 years and having worked for some of the largest consulting firms in the world, I get asked this question a lot by new technology organizations stepping into the healthcare industry in the US, as well as established organizations struggling to keep traction and be relevant in today's ever changing industry landscape. And the question is, how do we build a healthcare consulting practice that enables us to solve for the most challenging problems in the healthcare industry, be seen as innovators, agents of change, trusted advisors, and generate revenue? So to answer this question, today we will take a deeper dive into what it takes to build a world-class healthcare consulting practice that provides cutting-edge business and IT solutions to payers, health insurance companies, providers, large hospital systems, and government regulatory bodies, which include CMS, Medicare, and Medicaid. These will be our three key market segments for today's discussion. The healthcare industry is evolving fast, and the demand for innovative consulting solutions is higher than ever. If you're ready to build a practice that makes a difference, let's get started. Healthcare consulting is one of the most in-demand and lucrative fields in the industry, with organizations seeking strategic guidance, digital transformation support, streamlining operations, and gaining market share while utilizing innovative ideas and modern technologies. So, let's talk about the key building blocks needed to build a world-class healthcare consulting practice. These building blocks are the key pillars on which your practice will stand, and weaknesses in any of them will result in significant issues. The four key building blocks are defining your niche and building on it, defining and maintaining your key economic buyers, and establishing industry partnerships and talent management. So let's talk first about defining your niche. The most important thing in the establishment of a practice is to determine early on is what will your market niche be. If you want to be a provider of bodies, then this video is not for you. Body shops are a thing of the past, and I'm not interested in working for an organization to build a body shop. I also very firmly believe that most of these technology jobs related to software development, quality assurance, engineering that have been sent to other parts of the world will be completely taken over by AI. I will be talking on this topic in another video of mine. For now, let's focus on defining your niche, and to do that, you need to determine and clearly define what problems you will solve for healthcare and for whom. Let's take an example. Let's say that you end up defining your niche as digital transformation and AI or artificial intelligence. Then the next step would be to understand what some of the key challenges are that can be solved by utilizing these technologies within the three market segments of commercial payers, hospital systems, and the US government sector. For each one of these, you would need to do an in-depth market analysis to understand where these three bodies are investing their money, and then you would need to realign your niche, related solutions, and your strategy with their most pressing business needs. All this means is that you will still focus on digital transformation and AI, but you adapt to the market segment's most pressing problems rather than solutions of your own. You can certainly define solutions of your own concurrently for areas that you feel the market is not yet ready, but will be in the near future, or a completely innovative and disruptive solution to improve outcomes, improve financials, and reduce cost of care. But you do all of this after you have first aligned yourself with the most challenging problems for the healthcare market, so you can capitalize on those opportunities and generate revenue. And you will need to continuously keep aligning yourself with their ever-changing business needs to make sure that you're relevant and are seen as a true partner that adapts well to the ever-changing business needs of these organizations. Each one of these bodies is extremely different from the other, so one size does not fit all here. I believe that some of the top healthcare consulting niches are innovation and digital transformation, financial optimization, strategy development and commercialization, data analytics and AI integration, regulatory compliance and policy advisory, and cybersecurity. Now, let's move to the next pillar, which is defining key economic buyers. After you're done defining your niche, it's time to understand who your key economic buyers are in the three market segments of payers, providers, and government sector. These must not only be at the C-level or the executive level, but also down to the directors or the senior director level. In my experience of 20 plus years, having a C-level executive relationship is necessary. However, most of the time, decision-making goes down to the director or the senior director level because that's where the budget has been allocated. So it is imperative that you develop relationships across these organizations from top to bottom to ensure maximum penetration and to ensure that you're dealing with the right economic buyers who have the ability to sign on an SOW and get you the work that you want. After you have defined your niche, you have defined your key economic buyers, buyers in all three market segments, which are commercial payers, hospital systems, and the government sector. Now it's time to build industry partnerships. The type of partnership that I have found to be extremely valuable is to build a global healthcare partner ecosystem. Around the globe, there are organizations that are developing extremely disruptive solutions and bringing them rapidly to the healthcare market. Now, since they're global, they might not be aware of the laws and the regulations that exist in the United States as it relates to the healthcare industry. That's where you need to evaluate them, build relationships with them, and bring those solutions and those organizations to the US market. Then you can take these solutions to your clients to help them solve their most important problems. Let's take an example. If you build a relationship with an organization that can do the identification of diseases such as depression by using voice biomarkers, they may not know how that solution will benefit any of the US buyers in the three market segments. And they may also not know how to position the product in a way in which the benefits are seen by these three organizations so that they would then go ahead and invest in that product. But that's where your expertise comes into play, and you need to turn that solution into a solution that's marketable and that sells in the US market with these three organizations. And that these three organizations actually are able to adopt the solution without many regulatory issues either. Once you have several of these key relationships, you can build solutions around these that are more comprehensive in nature. Rather than just saying that there's a solution to be able to identify depression in adults over the age of 18 to 55, which adds no value to any of the organizations, you can build an entire solution to say that we will help you identify high-risk patients or people that have a high risk of depression or people that are currently depressed, and we will be able to route them to accurate resources to allow them to be able to get the care that they need at the right time. In doing so, you establish a phone hotline for people to call if they're feeling depressed. Depending upon the couple of questions that the natural language processing or NLP IVR system is going to ask them, it can accurately gauge if a person is having suicidal thoughts and direct them to the suicide prevention hotline. If the symptoms are mild, it will connect the person to a chat room where other people are talking anonymously, and they can contribute and they can share some of their thoughts as well and feel better about themselves, and their condition becomes better. This was just an example, but building a solution around the product is extremely important, because if it helps solve a problem, that means either the cost of care goes down, or their financial improvements, or the health outcomes are improved, or MLR reduction, then that means something to the three buyers. Again, they're the payers, the providers, and the government sector. And every company, whether it's a payer, provider, or government, in addition to being able to provide health care to individual, is laser focused on their financials. It is extremely important, especially on the hospital system side, because there are hospital systems that are running on 2% or negative 2% margin. Last but not the least, talent acquisition and management. So I would like to add that your healthcare practice is as strong as your weakest link. Invest heavily in identifying and then onboarding the right talent. Your talent should be a mix of strategy experts, product experts, innovators, AI experts, healthcare experts, and people who understand the industry from end to end, whether it's the payer industry, the providers, or the government sector. Hiring the right talent across the board is the key to success. When you're thinking of building a practice, not only do you need to hire the right talent within your practice, but you also have to hire the right talent within the sales and marketing organizations. People who have had previous experience in the healthcare industry would be extremely valuable, because not only will they understand the tough nature of the industry, they will understand how to message, they will understand who to message, they will know how to play to the market and the industry, and how to always be relevant, and how to align themselves accurately with the emerging industry trends. So when you think about building a holistic practice, don't just think about the practice itself. Think about how you would like to have the right level of interaction, talent, and passion, but not just within the practice, but also with your counterparts in the sales, marketing organizations, and other business areas of your organization. Conclusively, I would like to reiterate the few things that we have talked about in the video. Number one, sit down and define what you want to do in the healthcare industry, and what problems are you willing to take on and solve for, so you can be seen as an innovator, as a digital disruptor, rather than just a provider of bodies. You don't want to be in a situation where you're fighting another company that has been doing business with your customer for 15 years over $27.30 versus $27.25 for somebody sitting offshore. Next, define your economic buyers, people who are going to buy your solutions from your practice. Once you have those defined, invest your time in building industry partnerships with healthcare startups from around the globe that you can then help bring into the US healthcare industry. Lastly, talent. Cannot stress this enough. You need to have amazing talent, which means your investment is going to be higher. Don't shy away from that. Invest in the right people. You see what's been happening in the industry, mass layoffs by some of the largest consulting firms over the past 2 years. Bad planning on their part, now resulting in a talent drain. You don't need to be, or you don't ever have to be in that situation if you play your cards right. Hire the right talent, scale accordingly, manage your resources, manage your talent accurately, and reward people for good work. Culture matters, and it's important that you build the right culture for your organization. I believe with these core principles and building blocks, you can build a world-class consulting practice which will disrupt the healthcare industry and will bring about very positive change to the market and generate revenue for your organization. These are just my thoughts after being in the industry for over 20 years. What are your thoughts? Do you agree or disagree with what I have said? Regardless, I would love to hear your thoughts in the comment section below. Thank you for your time today, and if you liked the video, please click like, subscribe to my channel, and share the video with others. Thank you.